home monitoring of patients with neovascular macular degeneration in one eye, or even non-neovascular macular degeneration in both eyes, or even a patient that is treated for neovascular macular degeneration in both eyes, is very important and holds a lot of promise to the future. The problem is that if we are starting to talk about long-acting drugs or slow-release devices, or just extending the treatment interval, such as treat and extend approach, in all these situations, we need something to make sure that the drug is still working. So if we want to really lower the number of visits, it would be very beneficial for us to have a home monitoring technology that the patient can use in between visits, not instead of visits, but in between these visits with a longer time interval between them, to make sure that the drug is still working. If we talk about the future, topical therapy, oral therapy, then home monitoring can also serve as a way to test the compliance of the patient to the treatment modality. And even today, when many people are treating patients by a treat and extend approach, and we know that, for example, in neovascular macular degeneration, 50% of the patients have bilateral disease, then a treat and extend approach is pretty complex when you talk about bilateral disease, and this can be solved by home monitoring. I participated for many years in the development of the preferential hyperacuity perimeter for early detection of conversion of non-neovascular dry macular degeneration to neovascular wet macular degeneration. And this technology is working and is being used in the United States. Now we are working on the development of a home OCT. A home OCT needs to be a very simple device that can be used by elderly patients who are visually impaired at home and produce images that are gradable. In addition, there needs to be some infrastructure that will grade these images and will provide some kind of guidance to the patient and maybe alert his physician that the patient needs to be seen. So specifically, I'm talking about a home OCT, and we did a study that included 48 patients, elderly patients from my clinic. They were up to 92 years of age, and of these 48 patients, 45 were able to do a self-OCT and provide gradable images. And we graded the images that they provided and compared them to findings from a commercial OCT that the patients also went through. And we found more than 90% sensitivity of specificity as compared to the gold standard, which is a commercial OCT. Patients were very satisfied with the ease of the task and were able to do the self-OCT very easily. We also developed a technology that can segment the images, provide the layers, ILM and RPE, and give a score of lesion activity, taking into consideration the existence of subretinal fluid, intraretinal fluid, and PED. And we have already published this technology showing that this analyzer, which is based on machine learning and artificial intelligence, can actually diagnose the development of CNV. And now the same technology is being developed for the use by the home OCT. I think the home OCT will be proven as a very important technology in the treatment of our patients in the future, when we are getting into an era of long-acting drugs, slow-release devices, and extension of treatment intervals between visits.